frequently asked questions about personality disorders. What is the definition of personality? Personality is the sum total of the characteristic patterns of thought, emotion and behavior that define an individual's personal style and that influence his or her interactions with the environment. What is the value of identifying personality disorder? The value of identifying patients with personality disorder lies in alerting the doctor to certain predictable problems that may arise in the course of treatment and in guiding doctors to respond appropriately to their presenting complaints. What are the causes? Personality is the combination of thoughts, emotions and behaviors that makes you unique. It's the way you view, understand and relate to the outside world, as well as how you see yourself. Personality forms during childhood, shaped through an interaction of your genes. Certain personality traits may be passed on to you by your parents through inherited genes. These traits are sometimes called your temperament. Your environment. This involves the surroundings you grew up in, events that occurred, and relationships with family members and others. Personality disorders are thought to be caused by a combination of these genetic and environmental influences. Your genes may make you vulnerable to developing a personality disorder, and a life situation may trigger the actual development. What are the risk factors? Although the precise cause of personality disorders is not known, certain factors seem to increase the risk of developing or triggering personality disorders, including family history of personality disorders or other mental illness, abusive, unstable or chaotic family life during childhood, being diagnosed with childhood conduct disorder, variations in brain chemistry and structure. What are the defining features? As a group, the 10 types of personality disorders, patients have 4 defining features of distorted thinking patterns, problematic emotional responses, over or under-regulated impulse control, interpersonal difficulties. What are the complications? Personality disorders can significantly disrupt the lives of both the affected person and those who care about that person. Personality disorders may cause problems with relationships, work or school, and can lead to social isolation or alcohol or drug abuse. How is the assessment for personality disorder done? The assessment of personality disorder has 3 components. Diagnostic history taking. Often, the definitive diagnosis can only be made after a period of assessment if the patient has other psychiatric symptoms or is uncooperative at the initial evaluation. However, a detailed description of the premorbid personality may provide hints of an underlying personality disorder. If the presenting problem is a recurring one, for example repeated deliberate self-harm or suicide attempts, fights, legal suits against others, multiple failed marital or intimate relationships, the possibility of an underlying personality disorder needs to be considered. Characterize the type of personality disorder. Having obtained clinical evidence that a patient has features of a personality disorder, the next step is to begin to describe the core features. The present psychiatric diagnostic classification systems group the types of personality disorder into 3 clusters. In clinical practice, it is not unusual to find mixed features in an individual with personality disorder. Screen for the coexistence of psychiatric disorders. Patients with personality disorder are vulnerable to developing various psychiatric disorders under stressful situations. Anxiety, depressive and even psychotic symptoms may be the presenting complaints of patients with personality disorder following a significant psychosocial stressor. A patient with borderline personality disorder is likely to become depressed and suicidal and even transiently psychotic when there is perceived abandonment by persons he or she has become attached to. A patient with paranoid personality disorder is likely to become extremely anxious and aggressive when confronted with irrefutable evidence of a personal shortcoming. A patient with obsessional personality disorder may function fairly well under routine conditions but may become very anxious and even depressed when there are unexpected changes. What are the general strategies for relating to the patient? Establish a good therapeutic rapport right from the beginning. Apart from adopting common courtesy and good communication skills, a doctor's taking time and effort to learn something about the patient's life story would be helpful in both identification of such patients as well as in establishing a good platform upon which the doctor may suggest helpful treatment measures. Developing an empathic stance by frequent validation of the patient's emotional distress can be very helpful. A balance between being accepting of certain fundamental aspects of the patient's personality and being firm in handling certain unacceptable behavior is necessary. Be honest about your feelings and limitations with these patients. The attending physician may feel himself or herself manipulated by the patient. It is important not to act out negative feelings in unprofessional ways. Doctors who do not have self-awareness or have unrealistic expectations of themselves or their patients are likely to encounter difficulties with this group of patients. Doctors attempting to provide counseling or psychotherapy to this group of patients need to have realistic short-term objectives and adequate professional support and supervision. Crisis management. Patients with personality disorders react poorly to recurring stressful situations and often seek help at points of crisis. Some working knowledge of crisis management is important to be able to offer helpful suggestions without resorting to unnecessary prescription of psychotropic medications. Knowing how to respond when a patient threatens suicide, exhibits aggressive outbursts or makes unjustified hurtful remarks may prevent the escalation of destructive behavior. What is the treatment? Psychotherapy, also called talk therapy, is the main way to treat personality disorders. Psychotherapy. During psychotherapy with a mental health professional, you can learn about your condition and talk about your moods, feelings, thoughts and behaviors. You can learn to cope with stress and manage your disorder. Psychotherapy may be provided in individual sessions, group therapy, or sessions that include family or even friends. There are several types of psychotherapy. Your mental health professional can determine which one is best for you. You may also receive social skills training. During this training you can use the insight and knowledge you gain to learn healthy ways to manage your symptoms and reduce behaviors that interfere with your functioning and relationships. Family therapy provides support and education to families dealing with a family member who has a personality disorder. Is there a role for pharmacotherapy? There are no medications specifically approved by the Food and Drug Administration, FDA, to treat personality disorders. However, several types of psychiatric medications may help with various personality disorder symptoms. Antidepressants. Antidepressants may be useful if you have a depressed mood, anger, impulsivity, irritability or hopelessness, which may be associated with personality disorders. Mood stabilizers. As their name suggests, mood stabilizers can help even out mood swings or reduce irritability, impulsivity and aggression. Antipsychotic medications. Also called neuroleptics. These may be helpful if your symptoms include losing touch with reality, psychosis, or in some cases if you have anxiety or anger problems. Anti-anxiety medications. These may help if you have anxiety, agitation or insomnia. But in some cases, they can increase impulsive behavior, so they're avoided in certain types of personality disorders.
Audio Jungle. Audio Jungle.